punctual, always at your service. Kindly subscribe to the channel for more videos. You can leave your comments at the comment section. Today we are coming to talk about caesarean section or CS. So caesarean section is when a woman is being taken to the theater or the woman delivers the baby through operation. There are a lot of things that will account for caesarean section. So caesarean section too, we have planned caesarean section and we have emergency caesarean section. Planned caesarean section is when the woman has requested for it. The woman and the husband has planned that we won't deliver. I won't allow my wife, or my wife will not deliver through the vagina, but through operation. So you decide, you see your doctor, then your doctor will book you or will give you a date that they will do the caesarean section for you. That is planned caesarean section. So you plan, the woman and the doctor has planned. We've given you a date that may be 27th October. We will do your operation for you. 25th October, we do your operation for you. So that is planned caesarean section. Then we have emergency caesarean section. Emergency caesarean section is when, let's say, labor has set in, you are in labor. And when you came to labor, upon assessment, we got to know, or your midwife got to know that your baby is presenting with the hand. When your baby is presenting with the hand, we have to rush you for caesarean section. With that one, meaning the baby is across like this. So when the baby lie across like this, the head is here, the leg is here, the baby, you can't deliver vaginally. Or the labor has started and we go to a time, your cervix is not dilating again. Maybe you go to 4 centimeters. After 4 hours, you're still at 4 centimeters. Another 4 hours, you're still at 4 centimeters. That one, you have to rush you for emergency caesarean section. Emergency caesarean section is any caesarean section that we did not plan or we did not book you for. That is emergency caesarean section. So it can be that you came into labor and realize that your BP is very high. So you have to rush you for caesarean section. You came into labor and you realize that your baby's fetal heart rate or your baby's heartbeat is now it's high or it's very low. So we have to rush you for caesarean section. Or labor has started, you are in labor and all of a sudden you are bleeding profusely. You are bleeding profusely, or what you got, you've gotten abruption, placenta abruption. That is, the placenta has detached. We have to rush you for caesarean section. Or the labor has started and you got to know that the mother doesn't have the strength. The mother is not having the strength to push. So you have to rush you for caesarean section. Or maybe we induced labor did not start spontaneous, labor did not start by itself. So we did induction of labor or forced labor for you and it has failed. After giving you the cycle of drugs that we are supposed to give you, labor still did not set in. With that one, we have to rush you for caesarean section. That is not planned caesarean section. It's still an emergency caesarean section. So somebody will decide, me, I won't go for caesarean section. I want to deliver by myself. Yes, you've planned to deliver by yourself, but in the process of delivery, anything can happen that we don't have anything to do about it but to rush you for emergency caesarean section. Then we have some people that we will book them for caesarean section. We will give them the date. The date will not reach, but labor will set in. So they will come. Such people can also come and deliver by themselves. So it doesn't mean if we book you for a caesarean section, you can't deliver by yourself. You deliver. But let's say you've done about 2 or 3 operations. You've done about 3 CS or 2 CS. That one, when you book you and it's not yet your time and labor setting, we still have to take you to emergency CS. That one, it will not be a planned CS, but it becomes an emergency caesarean section. So basically that is it. So someone that we've booked for cesarean section can turn into an emergency cesarean section. That's when the time doesn't reach, when the stipulated time for the cesarean section doesn't reach and something comes up. Let's say you are 2 previous years or 1 previous year to short interval, it's not up to 2 years and you are pregnant, giving you a date and labor setting, you have to rush you for emergency cesarean section. So that is it. And people were saying if you deliver by cesarean section, you did not deliver. No, you deliver. It's also part of delivery because you also go through pains. Though initially as you are going for the cesarean, you won't feel any pains. But when the anesthesia drug is leaving the system, you feel the pains. The after pain is there. You also feel the pains. There's that the person who go through normal labor or vaginal labor will feel the pains after delivery. The person will be okay. But you will not feel any pains after the cesarean section. When the anesthesia drug is leaving your system, you see that you feel the pains. There will be wound. It will take time to heal. It's also pain, so you go through the pains. It's still part of delivery. So whether you deliver vaginally or you deliver by cesarean section, it's also part of delivery. So don't be saying you've done your CS. Yes, when you do CS and you wait for 2 years interval, the next one you can deliver by yourself. Or when you deliver, yes, and 2 years and you can deliver. But if you deliver and the interval is very short, less than 2 years, that one you also book you for cesarean section. We have some people, you book them, like I said, they will still come and deliver, but the risk involved is very high and we don't want you to go through the risk. You can even lose your life, and that's of the baby. We don't want it that way. So that's why when you deliver and the interval is less than 2 years, we still book you again for cesarean section. Or if you've done 2 or more cesarean session, we book you again. Because when it happened that way, the uterus is now weak as compared to someone who has not delivered before. You the one who has done 2 cesarean session, your uterus is weak, so we have to handle the uterus with care. That's why we don't allow you to go through the process of labor, that you go through all this contraction for 5 to 12 hours or something like. No, it will not help you. It will level. It can even rupture the uterus. When the uterus rupture, you can bleed to death, or you can remove the uterus, the whole uterus. You can't give birth again, and you don't want that thing to happen. That's why if you've done CS like 2-3 times, we won't allow you to go through the process of labor, but rather we book you for another cesarean session. So that's all about cesarean session. So whenever we book you for cesarean session, please come. Or whenever you decided to give birth per vagina and something happened so that we are rushing for emergency care, please accept. That's why in emergency birth preparedness and complication readiness, you have to prepare yourself that whatever comes through the process of through the pregnancy, you are ready to accept. So that's why you have to come with a decision making. So whenever we say something, you decide with the person that first we do whatever that we are supposed to do for you to prevent any unnecessary delay that will lead to maternal or neonatal death. In doing all this, the aim of doing all this is to reduce maternal and neonatal mortality and other complications that will arise during pregnancy and delivery. Thank you. It's your midwife. Kindly subscribe for more videos. You can also share with your friends. You can leave your comments at the comment section. Thank you.